ਕੈਲਗਰੀ ਵਿੱਚ ਅਲਬਰਟਾ ਦੇ ਸਿਹਤ ਮੰਤਰੀ ਜੇਸਨ ਕੌਪਿੰਗ ਅਤੇ ਅਲਬਰਟਾ ਦੇ ਸਿਹਤ ਦੇ ਮੁੱਖ ਮੈਡੀਕਲ ਅਫਸਰ ਡਾਕਟਰ ਡੀਨਾ ਹਿੰਸ਼ਾ ਵੱਲੋਂ ਮੌਂਕੀ ਪੌਕਸ ਸੰਬੰਧੀ ਇੱਕ ਅਪਡੇਟ ਪ੍ਰਦਾਨ ਕੀਤੀ ਗਈ, ਜਿੱਥੇ ਜੇਸਨ ਕੌਪਿੰਗ ਦਾ ਕਹਿਣਾ ਹੈ ਕਿ ਅਲਬਰਟਾ ਦੀ ਕੋਵਿਡ-19 ਸਥਿਤੀ ਵਿੱਚ ਸੁਧਾਰ ਜਾਰੀ ਹੈ, ਪਰ ਮੌਂਕੀ ਪੌਕਸ ਦੇ ਮਾਮਲਿਆਂ ਦੀ ਪੁਸ਼ਟੀ ਨਹੀਂ ਹੋਈ ਹੈ। ਨਾਲ ਹੀ ਉਹਨਾਂ ਕਿਹਾ ਕਿ ਕਈ ਡਾਕਟਰਾਂ ਨੇ ਜਨਤਕ ਤੌਰ ਤੇ ਕਿਹਾ ਹੈ ਕਿ ਇਹ ਬਿਮਾਰੀ ਇਲਾਜ ਯੋਗ ਹੈ, ਪਰ ਘਬਰਾਉਣ ਦੀ ਜ਼ਰੂਰਤ ਨਹੀਂ ਹੈ।
The data we're sharing today is from Tuesday, May the 31st to Monday, June the 6th, and it was posted yesterday online as usual. If you've looked at the numbers, you know that there's a lot of good news. I'm pleased to report that all the data, including our PCR positivity rate and wastewater surveillance, shows a continued trend of declining COVID transmission in the province. Between May 31st and June 6th, our average PCR test positivity rate was about 15%. That's a decrease of 2% from the previous week. As well, wastewater levels continue to trend down. They're down to or near the level before Omicron in many communities. The levels are higher in Edmonton and Calgary, and the levels fluctuate from day to day, but they continue to trend down. The result is that COVID admissions are down sharply. In fact, this is the lowest number of total hospitalizations we've seen since the peak in the initial Omicron wave, and the lowest number of ICU admissions we've seen since August. Overall, the wave of patients that's straining the system is beginning to ease. In the smaller regional centers, patient numbers and total occupancy are at or below the levels in the years before the pandemic. The numbers are still high in Edmonton and Calgary, with a few sites over 100% occupancy, but the levels are beginning to ease there as well. There should be relief for the staff in the coming weeks as the Omicron BA2 wave continues to recede. And once again, to all of our frontline healthcare workers, I'd like to say, now 2 weeks ago, I said that available data seemed to indicate that the BA2 wave was nearly behind us. Today, we can see that we are past this wave and in a period of declining transmission. Barring the arrival of any new variant or sub-variant that behaves differently, we expect to see low transmission rates throughout the summer, especially as more activities move outside. I hope that every Albertan has the opportunity to get out and enjoy the splendor of our province this summer and the weeks ahead. As we said before, we expect COVID to become more of a seasonal occurrence with higher rates in the colder months similar to the annual flu season. Our teams at Alberta Health and AHS are already looking ahead to the fall and winter and making plans for a potential rise in COVID and influenza cases then. And I can assure you, we will be prepared. In the meantime, we'll keep working to add capacity to our healthcare system. It was subject to too much strain even before COVID, and obviously the pandemic has added to it, both by adding patients and by straining the staff we need to care for them. Let me give you just one point to show you how big the disruption has been and why we're seeing so much strain right now. Before COVID, we normally saw right around 2 million emergency visits a year in this province. In 2021, that dropped by a quarter, and it stayed down by about 10% through last year. That means 700,000 visits that would normally happen just didn't happen. So now some of those patients are coming in, and they're sicker than they would have been otherwise. And that's on top of the cases of COVID itself right now, and a late season flu and other viruses, and all the other things that bring waves of patients into our system. The care deficit is real. It's a huge challenge for the system, and it's the same right across our entire country.